Hello, and thank you for joining Wisconsin Parkinson Association's Ask the Expert video series. I'm Jeremy Otte, Director of Outreach and Education with Wisconsin Parkinson Association. WPA provides hope, community, support, and resources for people with Parkinson's disease and their loved ones. Today, we are going to talk with Susan Forbush, Clinical Director with Stowell Associates. Today, we're going to discuss what services Stowell Associates offers and better understand what care management is. Welcome, Susan. Thank you for joining us today.
Thank you for having me, Jeremy. I really appreciate it. I really appreciate the opportunity to talk about care management. It's a passion of mine, and to highlight the services that Stowell Associates offers.
Well, perfect. Well, let's start with a little background about who you are and what your role with Stowell is.
Sure. So I actually have worked, I'm a nurse, and I've worked the whole continuum. I started my career with babies, and now I work with the geriatric population. And I have been in care management administration for about the last 15 years. I joined Stowell about 2 years ago after working solely in hospital settings. And I was so excited to have the opportunity to join Stowell and be able to do really wonderful care management that we can do for our clients, that we provide services that I always say are soup to nuts. We can do just about anything that the client needs, and we're here for them with our wonderful nurses and social work care managers.
Well, let's get a little bit into that soup to nuts. What are all the services that Stowell provides that people maybe can take advantage of?
Well, one of the things that's really important to understand is that everything that we do is very individualized. So clients come to us with varying needs, and we can take what they need and dive deeper to really find out what is keeping them up at night. What are their worries that they need someone to hold their hand and take care of for them if they will allow us to do that. And so, for example, we might have a couple that are in mid-age and they are coming to us to say, I want to plan out the second half of my life. And how do I do that? And what do I need to do? And what do I need to think about? And so we call it advanced care planning. And we really look at what documents do they need? Do they have their healthcare power of attorney put together? We work collaboratively with many attorneys to help them with their financial documents. We look at where do they want to reside? Do they want to stay in their home for absolutely as long as they can? And then if it gets to the point where they can't stay in their home anymore, where do they want to be? And we have really helped them look at that plan of relocation and individualize it for a couple who maybe spirituality is really important to them. So we're looking at a senior community that has that spiritual focus. Maybe nature is important to them. So we're looking for a place that has many outdoor activities. And especially looking at their needs medically as they get older, what senior community can really meet their medical needs. And that's really a specialized service that we can offer. Another thing that we are really specialists in is dementia and memory loss. So we have a number of social work care managers that are specialists in dementia care. And we provide a special program called creative engagement. What is creative engagement? A lot of people haven't heard of it before, they don't understand it. And so what it is it's an individualized program that we use with clients with either dementia, maybe behavioral health, patients with a lot of social isolation. And we put together an individualized packet of a program that really focuses on memories and conversation starters, because as it's very hard with a client with dementia to have a conversation and to know, do I talk about something that just happened yesterday, or do I talk about something that happened in their youth? And so what we found is that we do an analysis and we look at what is a strong interest of theirs. So I'm going to give you an example of a gentleman client that we had who really loved World War II airplanes because he used to be an engineer. And so one of our social work care managers put together a program about World War II airplanes. And we have a booklet. She has luminosity games. We have matching board games that we use to start a conversation about the airplane and talking to him about what does he remember about that, what's interesting to him about it. And it really has worked wonders, and we do it at least once a week for that particular client with a care manager. And then if they have home care and they have a caregiver, we teach the caregiver how to play some of these games with them, either on the luminosity game set or through the matching. And we have cards that we use for conversation starters, because I think especially for our caregivers, a lot of them haven't had that dementia training that we can provide them so that they really know how to work with a dementia client and have a wonderful conversation about opera, if that's what the client used to love, and play that music that the client used to love. Another focus that we really use is medication management. So in many of our vulnerable adult population, polypharmacy use really it affects their falls, it can affect delirium. And so we have nurses and trained social workers that work very closely with the pharmacists and with physicians to decrease the amount of medications that our clients utilize so that they can decrease the amount of falls or delirium. And we go in maybe once a week, twice a week, set up medications for them in cassettes or locked containers or reminder containers. If they have a caregiver, the caregiver can administer the medication, remind them about the medication that they need to take. And it's really been a lifesaver for many of our clients. I have an example of a client who always forgot to take an important blood thinner medication at one particular time of the day. She always remembered in the evening, but could not remember in the morning. And we tried many different aspects to try to help her with this. What we ended up doing was a care manager went to her house every morning and said, it's time to get up and it's time to give you your medication. And it finally worked. And she started then to get into the habit and was able to start to take that medication for herself on her own with our oversight. Now, I know with your population at the Parkinson's Association, falls are a huge risk factor. And we do a lot with fall prevention. So when we first meet a client, we assess what their fall risk is. And we immediately put interventions in place to try to reduce that fall risk and hopefully prevent the falls from happening. And we again individualize that for the particular client and what their medical reason is for the falls. If they're having an increased number of falls, then that's a whole new assessment to try to figure out what is going on and why is that happening. We also do specialized home safety assessments. So we go in and we look at the home and really analyze what is it that could contribute to a fall, to a problem in the home. If they want to reside in place, this vulnerable adult, we want to make sure that they're as safe as possible. So we recommend a lot of home modifications. We can help support and coordinate those home modifications, but we want to do what is best for that client so they can remain safely in their home. And then a unique thing that we also do is we give respite to caregivers. So a caregiver who's caring for a loved one and maybe they don't have support outside the home. It's just them caring for that loved one. And they end up feeling a lot of stress, and it can show in multiple ways. It can show in depression. It can show in insomnia. And so we can come in and do a tool, a screening tool that was developed by the American Medical Association. and we look at their continuum of their stress and really focus in on, is it depression? You know, is it insomnia? Is it just that they need that respite? They need a caregiver to come in so they can go for a walk in the park, or maybe they need a spa day. And so we really look at those things, that what is it that that caregiver really needs to give them that respite so they have the energy to go in and care for their loved one, because that's what they want to do. So that's a few of the services, the soup to nuts. We also help people if their furnace breaks down. So we're here for you for all avenues.
Well, and it truly is, Susan, soup to nuts. I mean, when I look at, you know, you help them get their affairs in order, you know, power of attorney, all that. You know, those are really important issues, but then you're also looking at future housing, dementia care, fall prevention, respite. So I think it really is, excuse me, soup to nuts. I want to touch on just a couple of the things you had mentioned. Medication management and fall prevention. To me, especially in Parkinson's, a lot of times those things can go hand in hand. Not taking my medication and falling more frequently. What kind of correlation do you see when you guys do some of those home assessments?
So a lot of times we have a client who has been to multiple specialists, and each of those specialists are prescribing different medications, and those specialists aren't talking to each other. And so we're there to be that conduit, to be that coordinator of care, and look at with each specialist to say, do they need this amount of drugs for their dementia? Do they need this amount of drugs for their Parkinson's? Do they need this amount of drugs for the fact that they had a stroke 5 years ago? And if they're a fall risk, do they really need the prevention of a blood thinner that could affect them negatively? So our nurses are typically the ones that do the medication analyzing with the physician and the pharmacist, but we also have trained social workers that are excellent. They're medical social workers. They know medications and what could happen with each of them. And we really look at decreasing, for the vulnerable adult, the less amount of medication that we can provide for them, the better. That polypharmacy use is really an indicator for us that delirium or falls could begin.
Well, and I think what you just said is huge, Susan. You talk about the team. You have a lot of people working together on this. It's something we talk about a lot is, I go to my Parkinson's specialist, I go to my knee specialist, I go to my heart specialist. And like you said, they're not communicating. So it's very important that if I myself am not able to do it, that I have a team like that to help me and really ask the questions that are important.
That coordination of care is huge, and it's something that just happens naturally for us. One of the first things that we ask a client is, who are your doctors, and may I speak with them? Is it okay if I help coordinate your care? And so many vulnerable adults say, absolutely, because I don't even know who I'm supposed to go to when. And telemedicine is a brand new, not new, but it's new for us. We're starting to use it more and more, especially during this pandemic when they can't get out to see their physicians. And so we really are looking to use one geriatrician or a geriatric specialist who could help put all those pieces together so that that client doesn't have to go to 5 different physicians.
I'm going to jump on something you just said. I think it's really huge. You talked about telemedicine. Like you said, it's not new, but a lot more people are using it all of a sudden because of the pandemic. Well, I'm going to tie that into, you just talked a little bit about respite care. Yes. We know respite care was really important before the pandemic. Now we have people who have been home alone together for 2, 3, 4 months now. How much more important is respite care? And then what does respite care from you look like? Do I have to come to a location? Do you have a caregiver come to my house for my spouse? What does that look like in your eyes?
Well, I want people to understand that if someone was a client of ours before the pandemic started, we have continued to check in. Even if we couldn't see them face to face, we've continued to check in with them all along. And I think when you were talking, it really reminded me of one woman that is caring for her husband, and the husband, they both live in a senior community, and she had our caregivers a couple nights a week just to give her a chance to have a full night's sleep. And then the pandemic came and she couldn't have that anymore. And so it's just starting to open up where we could bring a caregiver back in to give her that respite. But what we've done during this pandemic is at least have a conversation with her on a weekly basis, if not more, to say, we're here for you. And what could we do to support you? What can we do to help you? And even though we couldn't go in and do hands-on care for him, just knowing that someone was there caring and listening to her concerns helped her get through this. So a lot of times it is bringing a caregiver in. We might recommend that. And other times it's just being a listening, supportive ear.
And I think that's important. I think we hear the term respite care a lot, but people don't fully understand what respite care is. And I think you touched on it. And I think your point that I've seen in the community is not only could you not go in as a caregiver and give her that nightly rest, a lot of time the family couldn't go in. The sons,
Absolutely.
the daughters, the people who usually just get mom out to the grocery store, get her away for a little bit we couldn't do any of that. So I think it's important the phone calls and just checking in and making sure everybody's okay is very important. So we've touched on a number of different things here. I think you've really hit on. We mentioned care management. Can you maybe define what is care management in your eyes, and how does that really help people as they deal with getting older, having Parkinson's disease, or any other issue they may have?
Well, a nice way to really sum up care management is that we are the coordinators of their care and sometimes even their life. So as I mentioned before, the advanced care planning, the coordination of their medical and their physical care. We have a lot of clients that have behavioral health issues, and it's really being able to support them during the times that they're having a crisis and work them through that crisis. And it's really helping with disease control. So looking at someone with Parkinson's, for example, it's working very closely with their physicians, their physical therapists, their occupational therapists, their speech therapist if they need to build a care plan around what the other disciplines are doing, so that if you have a caregiver from Stowell, that they're following what the other physical therapist or the occupational therapist is doing. And that the client is getting exercises from us that are recommended by their physician. The other thing we do is really decrease distress. So often we get clients who they come to us in crisis and they don't really know what they need. And so that's why I was mentioning before, it's so important to dig deep and keep asking those questions of what is it that keeps you up at night? What is top of mind worry for you? And then keep asking the question, why is that a worry for you? And then asking the question, the question of, if I could alleviate that worry for you, would you allow me to do that? And then that's where the world is our oyster. We can do whatever that client needs us to do. And that is the beauty of our care management system at Stowell, is that we're not regulated by Medicare or Medicaid, and we can do for the client whatever they need us to do for them, to keep them safe, to help alleviate their fears and their worries, and to really help prevent maybe a hospital admission, and especially a readmission. Those 30-day readmissions, we're here to help you prevent that from happening.
And I think you just hit on two big points. You help decrease stress, And I know in my experience, they often don't know what they need. But on top of that, and I think you've touched on it, and I'm going to ask you a little more, not only do they not know what they need, they don't know what's out there. And I think that's where having that care management specialist who has, I always try and tell people when they call us, this is our job. We spend all the time knowing what resources are out there. You're dealing with the day-to-day of living with the disease. You don't have the time, and that's where we come in. And I'm sure that's where your care managers come in.
Absolutely, Jeremy. They are there as a resource to be able, and sometimes we do have clients that come to us and just say, I'm at a loss for what to do for my mom. I don't know what she needs. I don't know where to get it. I live in California. My mom's here in Wisconsin. Help me with what are the resources in Milwaukee for her? And sometimes we're just putting together a list of all those resources for the daughter, and then asking, now we've put these together for you. What's the next step? We'd really love to implement some of these programs. Let's get them to a memory cafe if they have dementia, and let's have a caregiver come in and drive them there. Oh, she's not eating well. Let's look at her nutrition. We have nutrition screening, and let us do the shopping. And we do a lot of shopping for our clients to get them nutritious, wonderful meals. Our caregivers do cooking so they can provide a wonderful, nutritious meal for the client, and they don't have to worry about that. And the families, the support that we can provide families is huge, because we have some people who they have no family around, and we are their person, the people that they call on for everything. And the family is so relieved. And that's one of the things that kept them up at night, was that they didn't know who's going to be there if my father falls in the middle of the night. Who's going to be there if he ends up in the hospital and I can't get there for 2 days? And we're there for them. So we're really here to enable the vulnerable adult to really reside safely in the setting of their choice with the long-term services that we can provide them, and support their maximum independence, their dignity, and their quality of life.
And I think, you touched on that earlier, Susan, and I think you just brought it up again. Trying to find them, where do they want to be? And then where can they be the most independent? I think a lot of times people assume, oh, we just need to put them in an assisted living facility. Maybe that's not what they want. So you have that discussion, and then how do we make them thrive and successful within whichever location it is? So I think you've talked about, you really do that assessment to find out where do they want to be. And I'm sure not every time you can honor those requests. Maybe they've just gotten to a point with no family and other issues that medically they can't live alone or at home. But I'm sure you go through the whole gamut with them to find the best possible resources.
We've had a client recently who really wanted to stay at home, and it required us to put 2 caregivers in during the day and 1 at night to keep them safely in their home. And that lasted for a couple years, but as the client's disease progressed, it became very obvious that home was not the best setting anymore for that client. But it took a lot of time to get the family and the spouse and the client to understand. And that's where our specialization in communication, therapeutic counseling, listening, our social workers with their social work background of being able to really mediate family meetings, to be able to get that client to the best setting for them. And then it's not just, then it doesn't end there. You don't just drop them off and say, bye, now we're done. We continue to help with that transition, worked very closely with senior community administration to get them to understand that we have been the provider of care for this family for years, and we want to make this transition a success. So we're still here for that client. And that might mean providing caregivers in the senior community for a while until that client really begins to get comfortable with what's their new setting and their new home is.
And we've talked about it a couple times, but I think maybe we should dive in just a little bit, and you've just touched on it. I think Stowell Associates is unique because you provide in-home care and care management. A lot of places I know they do one or the other. You guys do both. And I think you just touched on the example you used is you have that continuum of care through the beginning to the end. Can you touch a little bit on that uniqueness and maybe why you guys took that avenue to do both care management and in-home care?
You bet. It is a very unique model that we do. Many care companies either just do care management or they do home care, and the two don't meet. And our philosophy has been for over 35 years that it is very important that there is oversight of the caregivers in the home. So if a client comes to us and says, I just want home care, I just want a caregiver, I don't need care management, we're going to tell them you're going to get it from us because we know how important it is for that caregiver to have oversight and supervision. And we want a specialized care manager, either a nurse or a social worker, to put together the care plan for you and for the care with, very individualized in combination with what the client wants, and then work with the caregiver so that care plan is followed in just the right way. And sometimes it needs to be tweaked along the way, and that's why we're constantly checking in. We do monitoring visits, we do phone calls, we can do Zoom calls with the client and the caregiver to really be able to see how is it going and what do we need to do to find that right fit. The very first caregiver that comes in might not be the right person for that client. And so we know that, and we know ahead of time, and that we need to find a certain person. So I had mentioned dementia earlier and caregiving. And we want to look for a caregiver that really understands dementia, has seen our training for dementia, and really knows how to care for a dementia client. And so we really try to mesh the two together so that there's a nice, good fit of the caregiver and the client.
And I think you take the ego out of it. As a care manager, I'm sure you want everybody to love you, but you realize not everybody likes, not everybody personality-wise, you just don't mesh. So knowing that, hey, what's best for the client is it's not me, it's maybe somebody else on that team. And it sounds like you guys strive to really just find that perfect fit, because if it's not a perfect fit, nobody's going to be happy, and it's probably not going to work out for long run.
And that is so true. And sometimes we have a medically complex client who, if they had gone with a company that didn't have a care management oversight, maybe the client wasn't being transferred properly, or we go in and do the home assessment to make sure that the lift device that they're using for a transfer is being used correctly by the caregiver, that the home is set up correctly to support those assistive devices that the client might need. And someone else would just send in a caregiver and say, figure it out. And we figure it out ahead of time. So we make sure that that caregiver is trained and safely knows how to do what's best for that client. And so we stay overseeing a case from beginning to end. And regardless, it's built into the cost of what we charge for a caregiver. You're going to get a nurse or a social worker overseeing your care. And then there might be a change where all of a sudden, as I mentioned before, you can't live in the home anymore. You've already got a care manager you can call on to be able to help you relocate and find the best setting for you. You've got someone that you've known now for a year that you feel comfortable with, that you can talk to about those things.
That's great explanation. I appreciate that. And I think you kind of took away one of my little questions I was going to ask you. Is care management usually a short-term service or a long-term service? And I think you've kind of touched on is it's going to happen through the life of your interactions. And maybe it's more significant when it first starts, and maybe it's more of a check-in as you go, but then you never know when you're going to need more specialized services. Am I correct?
That is very true, Jeremy. We have some clients that are very short term that maybe come in for respite, for example. So you've got a loved one who's caring for their disabled adult, and they want to take a vacation from this. And so they bring in a caregiver and they need us only for a week. But we're there for that week, and then the next time they want to take a vacation, the care plan's already built. We know what the needs are. They don't have to go over everything again. Often we can get some of the same caregivers to come in, and so they use us again for that. And then we have other clients that have been with us for years and years, and we've followed them through their whole continuum of their adult life and all their needs that they've had through that. All the different continuum of, living in their home, now they have to be relocated, then they go on hospice care, and we're there for them through the hospice experience.
Well, we've covered a lot. You've given us a lot of information on care management, on services provided, etc. I think the one thing I haven't asked you that I really probably should have, like maybe 20 minutes ago, what coverage area and what area does Stowell Associates cover in Wisconsin? And then if people want to learn more about you, what's the phone number they should be calling to try and set up an appointment for an in-home assessment?
Excellent question. We started out over 35 years ago just in Milwaukee, so Milwaukee County. We now can service all of Waukesha County, Racine, and Kenosha. So we have expanded to those 4 service areas, and we have caregivers that will go to those service areas. We have care managers to all those service areas. And if you need our services, the best number to call, you could go on our website, and there is a link to put in that you would like services. But it's easier for you just to call. It's 414-963-2600. And that is the phone number for anyone, no matter if it's a Waukesha client or a Racine client.
Great. I appreciate that. I probably should have asked that a little while ago. Anything we haven't touched on, Susan, that you're like, Jeremy, we really should mention this because it's a really important thing that people should consider?
I think it's just important to consider at some point in your life to have an opportunity to talk to a geriatric care manager, whether it's in the second half of your life and through planning, whether you've just gotten a brand new diagnosis, or whether you're in crisis, because we need to really plan out what is the best way to live through our life. And we can live our best life that we can possible, and that you've got someone as a support for you through all those steps. And so we are here for you, as I mentioned, through all the continuum. We provide really unique, specialized services, and we'd love to hear from you. And we're happy to be here today and have an opportunity to talk about the incredible work that our care managers do.
Great, Susan. Thank you so much for your time today in providing such a great overview of what care management is and how it can assist people with Parkinson's disease to keep them independent for as long as possible. With that, we're glad you are checking in with Wisconsin Parkinson Association frequently. We are regularly updating our website and Facebook page with exercise classes, educational videos such as this one, and a number of other resources for you to take control in your Parkinson journey. You can email us at mail@wiparkinson.org with future topics you'd like to see us cover by local experts. Now, hopefully you're finding this educational video series beneficial. WPA relies on donations from individuals just like you, so please consider a gift today at wiparkinson.org to continue to keep all WPA programs and services free of charge now and in the future. Once again, I'd like to thank Susan for being our guest today. Thank you for joining us, and please take care and be well.
Thank you.